Bismillahirrahmanirrahim. I am Dr. Nasir Masood Malik. I am working as family physician for the last 35 years at my clinic named Canal View Polyclinic. Today I am going to give you some brief description of coronavirus, which is nowadays very hot topic. Coronavirus is the stepsister of the seasonal influenza virus, which attacks every year and which kills thousands of the patients every year, especially the extreme of age. These are the younger children and the older people. So the doctors always advise to have the flu shot before the start of the season, that is in September to March, which is the maximum chance of having this seasonal influenza virus. This stepsister, which is called the coronavirus, is behaving stepmotherly, and that have become violent and changed the name of the seasonal influenza virus to the coronavirus. If you remember, in the past, this virus also made a lot of havoc while behaving and having the name like SARS virus, bird flu virus, swine flu virus. So one can say, माँ का लाडला बिगड़ गया. This virus spread from a confirmed case of the coronavirus or a person who is a suspected case of coronavirus unless proven otherwise. The infection spread via the droplet infection. And droplet infection, as we know, that it is just when the patient is coughing, the patient is sneezing, or the patient is speaking loudly, so that is going to have the droplet in the air. And if in the same air, the other person who is just having the breathing can have this virus in his body through the nose or the mouth. When confirmed case of the coronavirus cough, sneeze or speak loudly, he just can contaminate the different fomites, the things which are around him, the clothing, the towels, the pillows, the beds, because this infected secretions that fall on that and virus remain viable on these things for few hours, and during these few hours, if someone have got contact with the secretion, one can have this infection in his or her body. By speaking, coughing and sneezing, one can spread the virus up to the distance of 1 meter. So the people, those who are in that range, they are very much prone to have this infection. So if the other way of the spread of this virus is if one is using improperly cooked meal or the eggs, because these are also the source of infection. Similarly, unprotected contact with the wild or the domestic animals, these are also a reasonable source of infection. A person infected with the coronavirus may have no symptom or may have mild symptom or may have the frank violent symptom. These are the fever, cough, breathing problem, sneezing, nasal discharge, and sometimes the patient have the pneumonia, which is maybe the viral pneumonia or it could be the super added bacterial pneumonia, which is the cause of the death in these cases. During this period, the patient is very infective and can spread the infection to the other people via droplet infection during coughing, sneezing and speaking. The infected secretion from that infected person fall on the different objects which are just around that person, like fomites, like furniture, and from there the other healthy person can contact that virus from touching these objects. And especially the hands are most frequent parts of the body which come in contact with these infected objects and the fomites. People put their infected fingers in their mouth, in their nose and eyes to take the infection to their body via their infected fingers which they have put on these objects. So the prevention is to avoid close contact with the definitely confirmed case of the coronavirus or with cold and flu symptoms and doubtful to have these problems leading to the confirmed case of coronavirus. So in that suspected case, one should avoid the handshaking, the kissing, the hugging, and if a person is married, sex of any time, any type during this period. But if one can avoid meeting any person with the recent travel to some other countries where the corona is prevalent, if a person is unable to postpone his sex desire, he can just use the protected measures like condoms, and one should avoid the mouth to mouth kiss, and one can use the cloth in between that. And the patient is asked to cover his nose and mouth during sneezing, coughing, or having the nasal discharge. One can use the flexed elbow like this, or one can use the tissue paper and dispose it properly in a closed bin, not in an open bin, because the open bin still can lead to the transfer of the infection from that to the other person. Infected person is advised to stay home till the time he or she fully recovers. Treatment, as it is said that if you will treat the patient, it will take 7 days, and if you will not treat the patient, it will take 1 week. It means no treatment. The disease is self-limiting and there is no treatment available yet because virus is killed by the interferon. As you know, the interferon which is given from the outside to treat the patient of hepatitis B and C, but in this case of coronavirus, the God Almighty do make the interferon in the body of the person who is infected, and these interferon are able to kill these viruses. One can offer the symptomatic treatment for the patient who is having the symptoms like antipyretic for the fever, antihistamine for the rhinorrhea, decongestant for the congestion, anti-inflammatory for inflammation, and the symptomatic treatment of the pneumonia, which is either the viral pneumonia or it is the superadded bacterial pneumonia, which can be treated symptomatically. And as it is said, the prevention is better than cure. So one is advised to wash hands frequently with soap water or some alcohol-based sanitizers or the wipes or the gel or the swab. Avoid using improperly cooked meat or the eggs, and also avoid unprotected contact with the wild or the domestic farm animals. Wearing the face mask, I personally feel that it has got no protective role, as one who is wearing the mask used to move the mask up and down, and as the virus is inside the air, and one can have the travel of the virus through the air to the nose or the mouth of a normal person. But it is advisable to the person who is already having this coronavirus infection to cover his face with the mask And the advice is that the person who is having this coronavirus infection should wear the mask in which the colored side is to be outer, and in case of the person who want to protect himself or herself from that patient, he should wear the mask with the white side outside, because the filter is on the outer side of the mask, and one should keep this thing in mind how to wear the mask. Other family members of the person who is having this infection, they should also wear the mask, but please the white side outside. And also disinfect the area and the objects, the fomites, the things belonging to the infected patient, and that should be disinfected properly just to avoid the spread of the infection. And there is no vaccine yet available, so just pray to the God for being protected from this coronavirus. Thank you.